Okay, today we're going to do mobile palpation. We're going to start with the occiput. So we would palpate the occipital ridge for any edema that would indicate a fixation on that side. For the mobile palpation, we perform the jaw jut and we're looking for equal motion on both sides. A restricted motion on one side would give us a listing. Probably a PSRS. We would need an X-ray to find AS occiput or the third component. Next, we're going to go over SI joint mobile palpation. First, we would palpate for edema. Is it okay if I open your gum?
Yes.
Edema above the PSIs would indicate a PI. Medial would indicate an EX, and inferior edema would indicate an AS listing on the restricted side. Next we're going to do forward flexion. Can you bend forward for me? And the thumbs should stay level. The one who doesn't move would indicate a restriction on that side. Next we're going to perform lateral flexion. Can you laterally flex to the right and to the left? Again, the thumb should stay level. Next we're going to do seated axial rotation. So I'd find the PSIs and S2. Can you cross your arms for me? I'm going to reach around you, is that okay?
Yeah.
I would bend him forwards and the S2 tubercle and PSIs should separate. If there's no motion, that would be an indicator for fixation on that side. Okay, next we're going to do standing glute fold. Can you stand up for me? I'm going to run my fingers off your thigh, is that okay?
Yeah.
I would run my fingers up, and the lower glute would be an indicator for a PI listing. The higher hand would be an indicator for an AS listing. Can you lay down for me and face down, please? Next, we're gonna do prone ilium width. So I would go behind him and I would inspect the glutes, which one is narrower and which one is wider. A narrow glute fold would indicate EX listing, and a wider glute would indicate an IN listing on that side. And next we'll do prone leg check. The leg that is shorter would indicate a PI listing, and a long leg would indicate an AS listing on that side. And lastly, we're going to perform gates. Just open. Can you walk from that side to the other side for me? So I'm watching the foot for an internal or external rotation. Internal rotation of the foot would indicate an EX listing, and an external foot flare would be indicated for an IN listing on that side. Okay, come on. You can lay down for me, face up please. Lastly, we're going to do right knee mobile palpation. And first we're going to do the popliteal relative muscle test. So I'm going to bring the patient's foot to internal rotation, stabilize on the lateral side. I'm going to move the patient, move your foot in this direction. Don't let me. If that would be weak, we would check the patient's the rotation of the tibia. I'm going to stand on this side for visual. So you can see 2 fingers on the tibial tuberosity, and I'm checking if the tibia is stuck in either internal or external rotation. and we would adjust to the opposite side. So if it would be stuck in internal rotation, we would adjust it in an external way. After that, we would retest the popliteal relative motion test. If it's still weak, we assume it's a posterior tibia, and we would adjust the posterior tibia, and then it should be strong.